well, folks, it's 11:01, so I'll get started. I just wanted to say thank you for joining, everybody. Today, our guest speakers are Rika Esguerra and Karen Platt of Right at Home Canada, which is an organization that provides in-home care and assistance to seniors and adults with disabilities. This is a two-part Zoom. Part one is today, and part two will be tomorrow at the same time. A little bit of housekeeping. I'll be muting folks. Attendees during the presentation. You're welcome to ask questions in the chat, and towards the end after the main presentation, you're welcome to unmute and we'll have a bit of a Q&A. There'll also be a survey at the end you'll be presented with, and you're welcome to fill that out. We're interested in feedback.
Wow.
So I'll say
I didn't stop the number, so there might be more than two.
So Rika and Karen, over to yourself.
Good morning. Thank you, Colin.
Good morning.
How is everyone today?
Good.
Good.
Great.
Wonderful. It's great to see so many people. We're really excited to start our conversation today, and we're excited about all of the possible questions that you may have. Just give me one moment. I'm just going to pull up my screen. Oh, it says...
Oh, sorry. Let me make you co-host.
All good.
I'm forgetting my my obligations here. One quick second. Apologies for that. Okay, you should be good to go. And
okay,
you're a co-host too, just in case. And Nazmi, you as well.
Okay. Now just give me one moment to navigate. Sorry, it's been a little while since I've used Zoom, so I'm just trying to navigate the presentation here.
Take your time. We can see on these on our screen, we can see it looks like your first slide navigating the healthcare system.
Oh, and is it still the same?
It's still the same, yeah.
Wonderful, wonderful. Okay, great. So again, thank you so much for inviting Rika and I. We're both very excited to be here today. My name is Karen Platt, and today I'm here to speak a little bit about the options that we all have as changes in our lives happen. So without any further delay, let's start looking at some of the topics that we'll be reviewing today. So as you can see on the screen, we'll be looking at life transitions and planning, understanding the process of healthcare and home care in Ontario, the options that everyone has available to them, and then getting into a bit of an understanding around what is the home and community care support, what is Ontario Health at Home, or as some of us may know, LHIN or CCAC or HCCSS. So we're going to be speaking about that as well. We'll also be talking about long-term care and retirement homes, family-funded home care, and just a little bit about Right at Home Canada, which is the organization that Rika and I are with. So no matter what your age, the best time to start planning for your future is right now. For the very young, it could be setting financial goals. For some, it could be retirement. Even for those already in a retirement residence, it's important to be looking at next steps so that everyone's prepared for both natural parts of aging as well as for the unexpected. So we need to plan for all of life transitions is the message. And educating yourself on navigation is important as we grow. Navigation looks so very different at each life stage. We plan for our future growth, happiness, and stability. And unfortunately, we also need to plan for life's challenges as well as transitions. So now let's take a look at some of the terms and acronyms that you may encounter when navigating the healthcare system. Part of our plan includes our unique circle of care, Your circle of care looks different at various stages of our lives. Each person's circle of care can be very, very different. A circle of care is a term that's used to identify those around a client that are involved in a client's medical journey. They are people that are medical professionals, community partners like government supports, as well as trusted and important people in your loved one's life or your own life. One of the important steps is to understand who is in your circle of care. The circle of care is unique to each person and can be made up of individuals such as family, chosen family, formal caregivers, family-funded caregivers, your family doctor, specialists, individuals that may be supporting you in the hospital, and so many more. So we encourage everyone to take some time to consider who is in your circle of care and be sure you have open conversations with your identified powers of attorney. So again, back to talking about acronyms. As we all know, the healthcare system is famous for acronyms. Often we get calls at Right at Home Canada where people are really not sure what the next steps are. And part of the challenge that they're facing is really understanding some of the terms that are being used. So in order to be successful in navigating our healthcare world, you'll find that you're faced with so many acronyms, and we want to just take a few minutes to review some of the typical ones that you may encounter when navigating for yourself or for somebody close to you. So during a person's healthcare journey, they will encounter many different types of specialists and support people. Here's a list of typical caregiver acronyms that you may hear. Many of you may have heard of PSWs, so they are personal support workers. They're not regulated, so it's important to choose a company that has a very strict hiring practices. This is even more true now in today's world because PSW certificates and background checks can be fake, so it's important to pick a company that does its due diligence. At Right at Home, we're dedicated to hiring the right caregivers, and all of them go through a robust screening and onboarding process. Our caregivers are fully trained before going in a home. Hiring the right caregiver is really just the first step. We focus on the importance of managing our caregivers, providing ongoing education and opportunity, as well as understanding the needs of our caregivers. And as you can see on the screen, there are many different types of acronyms that are used to describe caregivers. So we have care companions, we have supportive care providers, you'll hear reference to healthcare aides, you'll hear reference to DSWs, which is a developmental support worker, SSW is social service worker, an RN is a registered nurse, an RPN is a registered practical nurse, and IENs are internationally educated nurses. So one of the other areas that's important to talk about when we're looking at options and understanding those options is respite. For many of our families are actively involved as informal caregivers, and they are the ones that are supporting their loved ones when others are not in the home. This can be such a wonderful experience, as well as an exhausting and an emotional one. For myself, I have personally experienced that and lived that, and I'm sure many of you have as well. So taking a break is necessary for everyone in order to recharge. It's very similar to the direction given when you're getting on board an airplane. If you are supporting someone, put your oxygen mask on first so you can assist the ones you are caring for. We all need a break sometimes and life happens, so it's important to have peace of mind knowing your loved one is being cared for during your absence. So let's talk a little bit about ADLs. In the healthcare industry, we do tend to have many acronyms, as we've talked about. If you have not heard the term ADLs, it means activities of daily living. This is a term used during an assessment and care planning stages. It's used to identify routine self-care support needs for clients and patients. Generally, ADLs are those activities that we take for granted each and every day, like eating, dressing, bathing, going to the bathroom independently, transferring from chair to stand, and walking. Right at Home focuses on providing mindful support to clients and encouraging independence where possible for our clients to work within their abilities, allowing us to support where needed. Here's another acronym used in healthcare. Similar to ADLs, IADLs are instrumental activities of daily living. The IADL includes things like basic communication, such as using a regular phone, mobile phone, email, or the internet. Transportation, either by driving oneself, even arranging rides, or the ability to use public transportation. Meal preparation can be anything from meal planning, preparation, storage, and the ability to safely use kitchen equipment. Shopping, the ability to make appropriate food and clothing purchase decisions. Housework, doing laundry, cleaning, dishes, and maintaining a hygienic place for residents. Managing medications, taking accurate dosage at the appropriate times, managing refills, and avoiding medication conflicts, and even managing personal finances. So operating within a budget, writing checks, paying bills, using an ATM, using your online banking, and being able to avoid scams. Now, one of the other terms that you may hear when you're navigating for a loved one is capacity. And we often get a lot of questions around what is capacity and competency. Capacity describes a person's ability to make a decision. In a medical context, capacity refers to the ability to utilize information about an illness and propose treatment options to make a choice that is congruent with one's own values and preferences. A healthcare professional called a capacity assessor checks to see an identified person's ability to understand the facts they should consider when making a decision. They are evaluating the person's ability to process what could happen if they choose one option over another. Clients that are incapable of making important personal and financial decisions will require an appropriate substitute decision maker be appointed. And this cannot happen without a physician's assessment of the individual's capacity. DNR. A DNR means do not resuscitate. Many are not aware, but a DNR in a hospital and at home are very different. In home care, a legal DNR must be on file with an organization with the original in the client's home, and it must be signed by a doctor or a recognized nurse. Most clients receiving end-of-life care want to avoid aggressive attempts to prolong their lives. Medical culture and practices often contradict wishes for DNR. There is a lot of confusion surrounding DNR orders and how it translates into care. DNR does not mean do not treat, but it means treat with reason up to the point of resuscitation. It is a critical conversation that needs to be discussed and properly understood by everybody involved. Patients may request DNRs at various points of their healthcare journey, depending on how sick they are and the type of diagnosis, how their illness is failing to improve, and when they are getting close to end of life. Every time your medical environment changes, the code status should be reviewed. Critical conversations about code status is very important early on, allowing time for contemplation, questions, and discussions. Asking the question, to what end, is an important first step. It's a great opener and a way of helping clients and their families understand and weigh the options and decisions in this highly specialized medical world. We live and we die, and ensuring a natural death is a normal way of life to help with life's transitions and acceptance. So now let's take a look at some of the possible life transitions that you may need to navigate for yourself or someone you're caring for. We never know what can happen, and we can't predict personal health changes or emergencies. So, what to expect when visiting the hospital? With the help of your circle of care, your options, transitions, and next steps can be identified. Navigation is one of the gaps in our healthcare system. Often families and clients call with pieces of information, but also confusion with what the next steps are. Sometimes discharge is mentioned, but clients have questions on the what, when, and how. Sometimes plans are made, but need to change due to additional medical interventions needed. Often clients and families are questioning if the government support discussed will be enough, and they often question how they will manage when they get home with their loved one. Our supports start when someone has a need. Often that journey begins in the hospital, whether it's extra support during a stay, navigation and collaboration at discharge, transition support, or ongoing support. Our care planners can support clients during the discharge process and work to coordinate government-funded care, services, and in some cases, blending government-funded care with additional family-funded care. Ongoing navigation support is an exceptional care experience, and that is our approach. So, what are the options when transitioning? When care needs change at home, often people are asking us, what are the options? And it's really important to decide what works for you, because not all options are going to be the right fit for everyone. Initiating a call with family doctors is often the first step in someone's journey. A family doctor may decide that connecting with government supports from Ontario Health at Home may be the next call. Ontario Health at Home supports may not be allocated based on a needs assessment, but you may still identify the additional support needs that you do have for your loved one. Organizations like Right at Home support all those inquiring about care. Right at Home focuses on understanding on the front end of a conversation, the navigation side of things, navigating the current state, as well as the options that are available so that we can ensure that you're receiving the right care and it's the right fit for you. Often working with government programs, community programs, retirement homes, and LTCs is a great way to review your options and look at being able to layer in various services. So, what are the options that most have to consider? Let's take a look over the next few slides. So, the National Institute on Aging, otherwise known as NIA, published the findings of its 2024 Aging in Canada survey, the country's largest ongoing research initiative focused on the perspectives and experiences of Canadians aged 50 and older. Now in its third year, the survey sheds light on the evolving realities of aging in Canada, offering critical insight into the social well-being, financial security, and health of older adults. Ensuring Canada is a place where older adults can age with confidence requires the right mix of health and social services to meet evolving care needs. It's also crucial to support their ability to live independently in their own home and communities for as long as possible. In 2024, the 2024 survey examines the extent to which Canada enables community dwelling adults age 50 and older to age well with 3 indicators: access to healthcare, access to home and community care, and the ability to age in place. For those of you that have not had an opportunity, there are some fantastic articles and resources available on the National Institute on Aging website. So what you're looking at now is healthcare and home care options. So these options are based on stage. As we know, when we get older, our healthcare can start to decline and change, sometimes leaving us in need of additional supports, and that looks different for everybody. So we're going to take a few minutes now and break down each one of these options for a clearer understanding of what each one of these options look like and how they can work together and how home care can support. So home care can be defined in 2 ways: government-funded home care and family-funded. This is what's generally available to families using in-home care. Many talk about aging in place. So what does that mean? It's not always as easy as saying that I want to stay where I am. Safety is the key indicator, but may be overlooked because of a desire to stay at home. Ignoring the factors can lead to falls, hospitalizations, and changes in somebody's health plan. So always having a plan and educating yourself on the value and challenges of your options is important. So let's take a quick look at a checklist to consider when supporting a loved one in reviewing and understanding their personal options. So a person may need to look at their medical and physical status, financial resources, their family and friend supports, their physical state and accessibility of the home that they're looking to age in place at, as well as mental wellness. You may need to consider as well, will your loved one be able to go up and down stairs in their current environment? Will they be able to get in and out of a bathtub and a shower, or will modifications be required, or are those things possible? Will your loved one be able to get up from chairs, beds, and toilets? Reaching up, bending down to retrieve items from closets and shelves, using public transportation, maintaining and keeping up with the home, managing health, and being able to drive. This is just a really quick checklist that people are often using as a bit of a guide when they are looking at what some of the possible options are and how they may fit with their loved one's unique scenario. Oh, sorry, I forgot to advance. There you go. Perfect. So there are many advantages to staying at home when this is the right option. So we encourage everyone in our conversations to take a minute and think about what other advantages could be. With this, we also need to consider any potential risks, as we were noting. So I know talking about falls is everyone's favorite conversation. I talk with my mom about it all the time, and my children talk to me about it all the time now as well. But this is why we see so much research and information, because falls really are the leading cause of injury among older adults in Canada, and one small can make changes that are drastic. So let's take a minute now and talk a little bit more about government supports as well as family-funded care. The Ministry of Health is responsible for overseeing funding of Ontario's healthcare system, ensuring that resources are allocated efficiently to meet the needs of residents. As part of this mandate, the MOH provides strategic oversight and financial stewardship to Ontario Health at Home, formerly known as HCCSS, or perhaps the LHIN you may be familiar with, or maybe CCAC, which coordinates and delivers home and community care services across the province. Ontario Health at Home manages a network of contracted service providers and community support agencies, ensuring that clients receive high quality, accessible care that aligns with the ministry's vision. Through this collaboration, the Ministry of Health ensures that home care services such as nursing, personal support, and therapies, as well as essential community services like transportation and meal delivery, are delivered efficiently and meet the highest standards of care. This partnership reinforces the government's commitment to maintaining a sustainable and integrated healthcare system, ensuring that services provided through Ontario Health at Home operate in an efficient manner. As of June 28, 2024, the 14 home and community care support services have been consolidated into a single entity known now as Ontario Health at Home. So formerly known as HCCSS, now referred to Ontario Health at Home. The transition to Ontario Health at Home is a unified approach under Ontario Health to improve service coordination and quality, focusing on enhancing client experience and outcomes through seamless collaboration with community partners. The continued role of caregivers and community support services highlight the vital contributions of caregivers and community agencies in supporting home care needs. However, the family-funded side of care continues to play a significant role in managing the gaps that we see in our healthcare system. Ontario Health at Home continues to oversee contracts with service provider organizations to deliver home and community care across the province through government funding. Contracted service providers Ontario Health at Home maintains those contracts with various service providers or SPOs to deliver essential home care services such as nursing, personal support, social work support, physiotherapy, occupational therapy, and speech and language pathology. CSS, or community support services, these services include meals, transportation, supported homemaking, therapies, and home help, as well as respite services for caregivers and wellness programs. Family caregivers continue to provide essential supports such as transportation, domestic tasks, managing finances, and scheduling appointments, as well as personal care and assistance with medical tasks. So just a little bit of an understanding around how everything flows and fits in together will really help you to understand those key players and where their involvement really comes from. So many ask, what is the process to getting connected with government supports? A person can self-refer. They can get a referral through a doctor, as well as engage at discharge from a hospital. These supports are essential to our communities. These services can be received in your private home, in retirement home, and anywhere home is for that individual. These services can also work together with family-funded services to offset the cost of care. Once you have started the process, a case manager will be in touch with you to set up a time where they can meet with you and your loved one and assess the support needs. Some of the positives would be no cost to the client, access to various community services and programs. Some of the negatives discussed would be the inconsistency of caregivers and the inconsistency of supports provided, as well as the limited availability of hours per client, and often in some cases, the assessment reflecting no hours being allotted. So those are some of the positives and some of the negatives. Right at Home focuses on being able to work with families to blend care, because often individuals are in a scenario where they may be accessing government support, but they are also in need of adding some top-up family-funded care to be able to meet their loved one's needs at home. To address some of the challenges around consistency of caregivers, which is really a considerable challenge for a lot of our families and our clients in our community. Knowing who that person is that's coming into your home, especially when they're coming into your own personal area and providing personal services, it really is important that they know you, that there is a therapeutic relationship building opportunity, and that you have that knowledge of that individual, and that they're consistent in coming in so that you're not constantly having to retrain or meet somebody new. Right at Home has a care team approach, which allows us to focus on the importance of having those consistent faces coming into somebody's home, so that it does provide that opportunity for therapeutic relationship build. It gives a great break to those that are supporting by having the confidence in knowing that the individual that is here today will be coming back tomorrow, and will have increasing understanding of your loved one's needs. So the family-funded care, as we were just talking about, is often the option people choose when a little or a lot more support is needed. In-home family-funded care can provide a variety of services, medical, non-medical, and so much more. Often providers in the community will have a minimum number of hour requirements when you're calling them. This definitely varies between organizations. Set minimums can also, be something that you're faced with, per shift minimum, per week, or per month. The cost does vary between organizations as well. Services are paid by clients and/or client families through personal funds, health insurance policies, and other insurance policies like life insurance, and so much more. Tomorrow's presentation is going to dig in a lot more in regards to the ways to pay for the family-funded side of care to complement any government supports going into the home. So in choosing family-funded home care, you want to be sure you're doing your due diligence to find the right home care company for your loved one. Not all home care companies are the same. So just a few things to consider. Is the provider a member of a provincial association that has standards of care, such as Homecare Ontario? What services are available and do they fit your needs? Do they cover medical to non-medical and beyond? Not all organizations do have offer the medical side of supports in the home. How do they communicate with you and your family? Do they provide collaborative health system navigation or coordinated support? Just a quick note on coordinated support, coming from professional and personal experience. If you are navigating for yourself or for a loved one, and the scenario does require additional supports on top of what's been allotted by government care, it can make the transition and the navigation a lot easier when you're only having to deal with one provider, meaning a provider that works under the government-funded model as a contractor. So they have the ability to deliver those government hours, but also having that family-funded arm of care. By blending those two services together means that you only have one organization, one scheduling person, one care planner, and one care team, which makes a significant difference for
Daddy's
the
got a
person
phone call.
that is navigating for their loved one, only having to deal with that one point of contact. Caregiver hiring practices and training is also something that needs to be considered when choosing a family-funded organization. What are their policies if a caregiver can't make the shift? What are the terms of the contract or agreement that you're signing? Can they bill directly through your insurance companies or other options? And when can they start? So just a few things to consider. We do have many resources available on our Right at Home website as well that speaks to things to consider when choosing a family-funded organization. So let's take a moment now to look at some of the things that would be different in different environments. There are always exceptions, but this guide that you're looking at is a good guide on what you can access from government support and private care and what it really means. So companies like Right at Home Canada will assist you in navigating and connecting with government supports, as well as provide additional customized private care, family-funded care, wherever home is to you. So it may be in your personal home, family home, it could be in hospital, it could be in a retirement home, it could also be in long-term care. You can see on the chart that the differences between family-funded and government. General companionship is listed under private or family-funded. Government programs mostly provide task-oriented supports, and that's it. Meal assist. Family-funded can assist somebody with preparing their meals, with being able to eat their meals. Meal assist means that they, for the government, means that they will prepare a basic meal. So what that could mean is opening up a can of soup, or warming something up in the microwave. But when you're working with a family-funded organization, meal assist can mean anything from having a conversation around meal planning, building out the grocery list, going to the grocery store, working with your loved one to make some traditional meals that your loved one would be used to, being able to prepare some fresh homemade meals that can also be frozen and accessed by your loved one later. Whereas under government funding, it would be simply being able to assist that person in that time with the task of preparing a sandwich or something that would be basic, like warming something up, or opening a can of soup. Bathing is provided by both government as well as family funded. However, government supports when it comes to the personal care and bathing side of things. Often clients do find that it's not quite enough hours that are assigned during a week. So quite often organizations that are offering family funded care will be approached and asked if they can provide additional top-up supports to come in and support their loved one in being able to have some additional personal care support. Escorts and transportation within retirement homes or external, that is often something that is considered family funded. So it's not something that would typically fall under the government hours that would be assessed. Hospital stays requiring a bit of extra help at the hospital or at home during recovery can be provided both by family funded as well as government. But again, it comes down to the assessment of those needs. A family funded organization often is asked to be able to go into the hospital to support their loved one while they are in hospital, as well as transition with them when they are discharged. Medication support. Government programs will do medication reminders only. Family funded can take blood sugars and track insulin and assist in administering medication. So it looks different for each organization and each client's individual needs. So let's take a look at another option. So retirement homes in Ontario. The cost that you're looking at on the page is a range for one person based in Ontario. The number reflects an average range to expect. And of course, it would be more if there was an additional partner that is looking to move into retirement as well. Retirement homes can include various types of care within one home, usually offering minimal or no personal care supports. So again, each retirement home is very different. Often there will be extras available, but there quite often is an additional charge for those types of things, whether it's laundry support, sometimes meals may or may not be included, and various other packages can be made available. Clients are expected to have a certain level of independence when going into a retirement home often. For example, being able to get down to the dining room for meals and being able to independently sit at the table and eat their own meal. Those are things quite often that you will find are part of the assessment tools when a retirement home is working with somebody to determine whether or not they will be the right fit. When these things are no longer possible for an individual that is living in retirement or considering, that person may be in need of additional supports, which is where a family funded organization can come in to do some top-up care, or that individual, depending on the retirement home, may be looking at having to make a move to long-term care. While basic services such as housekeeping and meals are usually included in retirement, more comprehensive family-funded care packages can be added on top to ensure that the evolving care needs are met for that individual. There are advantages and disadvantages, of course, with every option. So when considering options, it's important to keep in mind that everyone's situation is unique to them. Living in a retirement residence can often make some things easier for people, but many don't know that you can also access additional services as needed, and that retirement homes may not be the right fit for everyone. So let's take a look now at LTC. There's another one of those wonderful acronyms. So what you're looking at on the screen is only referencing Ontario for the purposes of our call. When applying for long-term care, you will initially be involved in an assessment to determine the need. Most areas have a significant wait list as well as an emergency wait list. This is accessed through, as we were talking earlier, through having a relationship with Ontario Health at Home in order to be able to be considered and get on what they call the list for LTC. In addition to your co-payment fees, your long-term care home may also have additional charges for things that are optional, such as hairdressing, cable TV, telephone, internet, transportation, and things like that. And again, Ontario Health at Home is the one that manages the LTC list. So now let's take a look a little bit more. All right. So that brings us to our point in the presentation where we wanted to share a little bit with you about Right at Home. So in addition to our mission to improve the quality of life for those we serve, our vision to provide an exceptional experience to all stakeholders, we also have 7 core values that guide what we do and how we do it in our day-to-day. Just a little bit about Right at Home. Right at Home Canada is one of the largest providers of in-home supportive care services, staffing, government, and employer solutions globally. With over 700 care offices in 7 countries around the world and 57 offices in Canada, we are a trusted resource for tens of thousands of families, clients, employers, and government agencies in the delivery of a wide variety of highly professionalized, quality, supportive care offerings to individuals in their home, community, or wherever home is for them. Everything from making a pot of homemade soup to transportation to appointments to assisting with ADLs, personal care, end-of-life nursing supports, staffing solutions, nursing solutions, and beyond. Our full range of professional care services support a wide range of physical health and cognitive challenges, as well as highly specialized health and community initiatives. Our personalized, collaborative, and flexible approach assists us in designing and implementing the right solutions to meet the unique and often evolving needs of our clients or our partners. At Right at Home Canada, we are deeply committed to reflecting Canada's values in the care we provide. Our mission, vision, and core values guide us in our provisions of exceptional in-home care services that align with what makes Canada unique. Here's how we incorporate these elements into our daily operations, as you can see on our screen. So with Right at Home, we focus on 3 pillars. The care planner is one of the things that you've heard me reference earlier during today's presentation. The care planner is one of our most valuable members of our care team. They are the liaison between family care needs and Right at Home services. They're responsible for design and implementation of client care plans that are that are congruent with nurse care managers where applicable, reasonable for quality assurance, communicating changes to the care team, supporting care teams, and promoting client and caregiver satisfaction are just a few things that our care planners focus on. They work with our scheduling, our office, as well as your hand-selected care team, as well as families, community partners, and government supports. So as we talked about earlier in today's presentation, our care planners help our families often with being able to understand what their options are, understand some of the information that has been brought to them as perhaps changes, as well as being able to access introductions and referrals to various community support programs, government support, and working on being able to blend those services and being able to identify and address any gaps that may exist for somebody in the supports that they are receiving. We focus on our super service and the exceptional experience, humanizing home care, keeping our clients and our caregivers' satisfaction is always top of mind in everything that we do. And our care teams. Our care teams are hand-selected individuals for each individual client care scenario. Our caregivers are trained and highly supported and managed to ensure that they have the right skill, to ensure that they have the right resources, and to ensure that they have the right level of support, because they are the ones that are coming into our family homes and supporting our loved ones. Our care team members are individually identified based on a client's interests, care needs, and personal scenarios and requests. Oh, sorry about that. Right at Home delivers approximately 1 million care hours per year to hundreds of communities across Canada. In addition to providing family-funded care options, we also work directly with our community partners and our government funding, as well as supporting our community partners with staffing needs. Right at Home provides a complete spectrum of care, starting with clients who need assistance with simple home tasks, such as meal prep, shopping assistance, all the way up to 24-hour care and end-of-life support and everything in between. Right at Home will provide our clients with care in whatever setting, wherever they call home. For some, it may be in the home that they've lived in for their lives. For others, it may be in a sibling or a family's home. And for some, it may be transitioning. Perhaps it may be a temporary transition in hospital or during recovery. Whatever our clients' needs are, wherever our clients have the needs, we are able to go in and we are there to support and assist. Our Right at Home approach to quality care for individuals with neurological and/or complex care needs emphasizes meticulous training and the careful selection of caregivers who are the right fit for each client. So Right at Home has been really proud to announce to our community more recently our new approach around being able to provide customized training that's tailored to specific needs of clients. And we highlight how we are able to collaborate with community partners for disease-specific training. Additionally, working closely with clients and families to ensure the highest level of care and support. On the screen, you can see some of those individualized, specialized care team approaches that I'm speaking about. And after today's presentation, we'll be able to send you some additional information on each one of them. tomorrow, you'll notice that when we talk about resources, the first one listed there right now is our Ways to Pay guide. So that is something that Rika will be speaking with you about tomorrow. In addition, we also have the Right Conversations guide, our Falls Prevention guide. Our Right at Home Canada website is full of a number of very interesting articles, very valuable and useful resources. Our specialized care team brochure, as well as our various Right at Home Canada brochures are also available. And those are things that we would be happy to share with anybody on today's call. I just wanted to take a moment to highlight some of our community partners, especially when you think about our direct relationships within our community around our specialized care team approaches. In order to be able to create those specialized care teams, we needed to work with our community partners around unique education opportunities for our caregivers going into the home under those specialized care teams. And I do apologize. I think I may have gone a little bit longer than I had planned, but I wanted to take a minute to be able to open up the floor for questions.
Oh, thanks very much, Karen, for that comprehensive presentation. There's lots of information to process there. If anyone has any questions, by all means.
Are you going to send us some slides from this presentation?
Yes, absolutely. I have provided Colin with a PDF of our slides, and he will be able to share that with you after
Good.
today's presentation.
Yeah, thank you.
No problem.
Question for you. Is this cost tax deductible?
Yes, it is.
On a normal basis, like you've talked about so much services, and I guess it's individual client related, I understand that.
Mm-hmm.
But what is your normal cost with the people you have been dealing with on a monthly basis? Like you said, retirement home costs like $7,500. But if you were to take the home care services, how much are you looking at approximately?
So, yeah, so we'll definitely, in tomorrow's presentation, Rika is going to dig into more on the options around being able to pay for home care. There are a number of ways outside of government hours, as we were talking about. There are a number of ways to be able to offset the cost of family funded care through various other government funding options that may be available to an individual, as well as personal benefit plans that they may be involved with, or it can also depend on their unique medical scenario as well.
Okay, let's see. Somebody's got something on the chat line. Cost compare retirement, long-term care, home care. Let's share in the formula. Okay, that's fine. Let's see. Anybody else has any questions?
Yes, I have. When you say it is cost deductible, is it as a part of the medical expenses or on the entire slab?
I'm sorry, I didn't hear the last part.
When you say it is cost deductible, is it as a part of the medical expenses or on the whole?
Yes, it's something that you were able to claim as a medical expense, yes. And something that our care planners also assist families in being able to navigate, just as part of the support provided. There are often questions around how to access that and how to claim.
Medical expenses is only 3%. It's not a lot.
Yes, and there are a number of different options that our care planners work with the families to be able to navigate. Depending on each person's unique scenario, will reflect what is available to them. Rika will be speaking more in detail tomorrow during our Ways to Pay presentation, just around what that looks like.
Thank you.
No problem.
Any other questions? I noticed from what you're saying, Karen, that a lot of this service was provided by the government, what you're providing. So from what you are saying, it seems like a lot of service has been cut by the government, and then you guys are taken over where there's a charge involved. Am I correct in assuming that?
No, I would say that what it is that the number of hours. So one of the things that often we don't realize until we're having to navigate it, and I, have lived that myself with my family. Quite often what happens is an individual may be told that they require a certain amount of support, perhaps when they're in the hospital being discharged, for example. But when government support comes in, the case manager to do an assessment, it may be determined that they're only going to get, for example, a 1 hour visit at the start of the day and a 1 hour visit at the end of the day for support. But, upon discharge, the medical doctors are recommending that that individual receive 24-hour care, just as an example. So really what happens is that, the task-focused care that is provided by the government is very much for only the identified tasks that have been, noted during that initial assessment. But, with the need being so significant, the government hours are not applicable when it comes to a lot of the other areas that individuals may need support in order to be able to remain at home, independent and safe. So that's where a family-funded type of organization comes in to blend those services and offset some of the additional needs by being able to work with the hours that may already be assigned to an individual and be able to take on some of the other tasks that are needed that government care cannot do.
Okay, I got a question.
Go ahead. Go ahead.
Okay, if I understand correctly, Right at Home Canada, you are a private organization. Is that correct?
We are a family-funded organization, but we also work directly with our government programs as an approved provider. So one of the things that is unique about Right at Home Canada, although our initial focus was on the family-funded side of the work that we do, we have also developed relationships across Canada with our government providers, and across Ontario, we are one of their identified service providers. So we do go in the home as well under government funded care.
I see. Okay, and then I just compare your services to a financial planner. Like, financial planner advises me how to invest. You advise me how to take care of my family member and arrange the services. And the financial planner charges me ongoing monthly or yearly fees. Is that like I take your services only one time, you tell me what to do, or I take your services continuously as required?
That is a great question. So it is very different for each family-funded organization. Some family-funded organizations do have charges, as you're talking about, that are outside of just the hourly charge when you have agreed to have a caregiver or a nurse come into your home. Right at Home Canada does not work that way. Right at Home Canada does have a contract that you do sign, of course, to protect yourself, your loved ones, on the legal side of things and to identify your commitment. But that contract can be ended at any time. And the amount of care, so there isn't a monthly service fee necessarily when you're looking at having somebody come in, such as a PSW, to come in and do visits in your home. Right at Home also works with our program, our community programs, and our focus is in making sure that clients and families are really only accessing as much service as they need. So we invest a lot of time with families, just as part of our concierge approach without cost. We spend a lot of time with our families, ensuring that they are also aware of other services that are available to them in their communities that may fall under different government funding, or because of a client's unique scenario, such as the benefits they have, perhaps their past, they may be a vet, and various scenarios like that. So we very much focus on ensuring that families are receiving only what they need. Does that answer your question?
Yes, thank you.
No
I
problem.
find it a little confusing what your relationship is, private versus working with the government.
Mhm.
It's very complex. Do you have it broken down like what you were trying to say now?
So Right at Home Canada initially is a family funded, so private care. But through our relationships that we've built within the community. So let's, for example, when we were talking earlier about Ontario Health at Home, that is the body that carries the government funded care. Right at Home has gone through a rigorous process to be able to be approved as a provider that meets all of the ministry mandates that would be required to ensure that we can provide government funded care as well as family funded care. Does that help to understand, Linda?
Yeah, it does, but it needs to be written down where it is, clear what your services are and what they provide, because, you sort of, the government has, covers a certain amount, and when they don't, you're introduced. And if you want to go over and above that, you can do that too. Is
Yeah.
that correct?
Yes, and Linda, I completely hear what you're saying.
Yeah.
It is. I've been in the industry, most of my professional life, and when I was put in a position where I had to navigate for my dad and his wife, knowing as much as I know, I was still faced with a lot of challenges and navigation and understanding. So that's one of the reasons that Right at Home Canada focuses on the first step in a client's journey when they've reached out to Right at Home is to really understand, Linda, what has made you call today? What are the care needs and concerns that you have for yourself or for your loved one? And then from there, we support you by being able to have an understanding of what the current state is. Have you connected with government yet? If you haven't, that's going to be something that we're going to support you on, helping your understanding around, why you're going to do that and what the steps are, so that you can get an understanding of whether or not your loved one will qualify, because not everybody qualifies, not all scenarios qualify for government support. Even though you may need support at home, it doesn't mean that you qualify for government support. And then from there, our care planners will work with the person that's inquiring about services to, again, answer all of their questions, navigate what the financial side of things could look like for them, understanding that client's personal background and scenario, and what they may have available to be able to tap into, and understand what their current structure is in the home. And then from that, be able to work with them to understand what the additional needs are, so that Right at Home can support that person in ensuring that they're only putting in as much care as is really needed for their loved one.
When did Right at Home start partnering with the government? When have you come in to be part of this?
That's a great question. So we have had a relationship with our government partners from the start of our journey with Right at Home Canada.
When's that?
However,
How many
uh,
years has that been?
so that has now been 15 years, I believe it is, Rika, with Canada.
12.
12, sorry. Yes, 12.
Mhm.
I apologize.
No, that's okay.
And then, so there's always been a relationship that was, always Right at Home always focuses on the importance of relationship building
Mm.
with our community partners
Mm.
and working together with our community partners, because with our healthcare industry, one of the things that Right at Home understands is that it's not one support that's going to be the right support for everyone, and that it often takes a village to be able to customize the right supports for somebody. Through, I would say probably, I'm just thinking, based on the amount of time that I've been with Right at Home, we would have a direct relationship with the government outside of what I was just noting for 9 of those 12 years.
Okay.
Karen, would I be
Also,
right in
Is
understanding that?
I just want to ask
No, no, no.
another question.
Okay, hang
Is
on a second.
there competition with your company?
There are a number of in-home care providers in our community, yes.
That work with the government to do things like this?
Some do, and some do work only for the government, and some do have both family funded as well as government funded. But each organization is very, very different with their approach. And we really encourage, and we have resources on our website to support people in being able to do their own due diligence when they are calling. Because not all home care companies are alike.
Karen,
Yeah,
would I be right
I'm
in
just trying to
understanding,
get
just,
I'm just
Linda,
trying to get an
Linda.
under.
One
Okay,
second, Linda. Would I be right in understanding, Karen? There was a slide where the Ontario Health, describing Ontario Health at Home and how they manage a network of contracted service providers. Would it be describing the right context, say that they have you are one of the contracted service providers that Ontario Health at Home deals with?
That is correct. Yes, that is.
Perfect.
And it looks a little bit different in each area of Ontario because each area has, their own individual sort of body. But yes, that is correct. We are either a direct funder or a third-party funder or support, or we also are able to directly support under something that I'm not sure if you're familiar with, but self-directed funding as well.
Thank you.
It just seems like there's so many issues to this. And, to get it right, it takes some education.
That honestly, Linda, that is one of the things that Right at Home is very well known for, is our commitment to knowledge, training, education, because there are a lot of there's a lot of acronyms, there's a lot of options, there are new things popping up every day. One of the things that Right at Home committed to doing is realizing the number of gaps that exist in our healthcare system.
Yeah.
Again, being able to create those relationships and working directly with all of our community partners. Because of our industry, it's important that we all support one another. And in addition to saying that, it's important that we're working together because we all have the same common goal. And again, one of the reasons that Right at Home focuses on the importance of having the conversation is because we want to ensure that everybody understands what their options are and that everyone is only accessing the amount of care that is needed. And one of the things that we find is that, again, not all home care organizations are the same. So Right at Home is the organization that will take the time when somebody just simply calls to ask about care. We take the time to help understand what the current state is for that individual and their loved one, help to understand where they're at in their journey, and be able to help them with the navigation. Because as you noted, Linda, understanding what the options are, there are so many different things that are talked about and available, and things are changing drastically in the healthcare world. Right at Home focuses on supporting people and understanding that, and helping them navigate what their options are. And at the end of the day, if Right at Home isn't the right option or right fit for somebody that's calling in for services with us, we will then ensure that we have introduced them to something that would be the right fit for them.
Can I
Is
say
there,
that?
Hold
is
on,
there a
hold on,
cer-
Linda. Linda, hang on a second. Can we have this next guy talk, please? Go ahead, Garish.
Okay. Can I describe your services as one-stop shopping?
Yeah, we very much are a concierge type service.
Yeah. Okay. So when the emergency arises, somebody in the family gets sick or something, can I just sit down, or my caregiver sit down with you, and you tell them what are the options and explain everything, so I can hire your services just once only? Is that possible?
100%. So if there is a change and somebody needs support, reaching out to an organization like Right at Home, is always a great first step, because what we will do then is help you, help the caregiver, help your loved one to understand what are the next steps in their journey. Understand what their wishes are. Some people choose to not access government supports. It's a personal choice. Some people need support in understanding how to go about that. So making a call to Right at Home as your first call would always be a great step, because we will support you in those next steps.
Okay.
And we can continue to also be that support and that guidance. So quite often we will have somebody that has their loved one being released from hospital. Again, the information coming to that loved one has changed quite a few times. So quite often when we get on the phone, they're not really sure what they're in need of. They are not really sure how much, or if any, government support is going to be allotted to them. So they really don't know what to expect. And quite often they're quite anxious, because they're hearing discussions about discharge. They're hearing discussions about possible care scenarios, but nothing's been confirmed. So quite often we can support that person. We will even come into the hospital and support that individual and family by being their advocate at the discharge planning meeting, helping them to blend possible services with the hours that are allotted from the government and any other services that are being aligned. And then Right at Home will focus on filling in those additional support needs based on what the individual would like.
Do you have an option like customer service? When I buy an equipment I don't know how to operate, I call customer service. So do I have to be a monthly paid customer, or can I just call as the need arises?
Yes, you can go as the need arises.
Okay.
Sometimes people start with us and they may have one visit a month, just for their loved one to, be able to run errands, or perhaps just, do a help with duties around the home, some basic daily tasks. And as that individual's needs change, our services can change. Our services can grow or decrease. In the scenario where somebody's being released from hospital, they may need a number of additional support hours, but then over time that can decrease. So it really very much depends on the individual's scenario. But absolutely, there isn't a monthly subscription or anything. And our care planner and everything that we're talking about is all included in our hours and the services that we provide. And it's only as many hours as your loved one needs.
Okay. Any other questions?
Yes.
Okay, go ahead. Sorry.
Just one quick one.
Okay, Linda, go ahead.
Do you go by an hourly rate?
Yes, we do.
And what is that?
It depends on the area that you're in. It depends on the office and, sort of the province that you're associated with. But our range can be anywhere from, I would say about 32 to maybe 42, depending on, the type of care, depending on the area, depending on the individual needs, and depending also on, in some scenarios, some families may be looking for 24-hour care. So then in that scenario, there quite often is, more of a packaged approach when somebody is looking for that amount of care. So it very much depends on what are some of the options that you have, your loved one has, as Rika will get into tomorrow,
Okay.
around ways to offset some of the cost. But that is just sort of an average. It's really a difficult question to
Let's
answer.
say for the Toronto area.
Yeah, okay. So it really is a difficult question to answer.
Okay.
The range is
Yeah.
the best that I could do, because it very much depends on what type of support somebody's going to
Okay.
need and what the skill set is for that individual.
Mhm. Okay.
This is a very heavy topic, home care. So if there are any other questions you guys have not been able to ask, maybe you can send us an email and we will forward it to the ladies later on, and maybe they can get back to us if that's okay with you guys.
Sounds good, Nazma.
Okay.
Perfect. Well, it was very nice meeting everybody, and we absolutely encourage, as we say goodbye today, if you do have any other questions, we're definitely here. Just send them over, and we are looking forward to seeing everybody tomorrow as well.
Thanks, Karen, for the
Thank
presentation. Thank you,
you.
Nazma, for organizing this, and thanks
Anytime.
everyone for attending and your interest in this.
No, it was
the
great.
topic which infects us as seniors. Yeah.
Yeah.
Cool.
Just
Gives
a
us-
reminder, there'll be a survey when you exit the, you'll be presented with a survey when you exit the meeting, and you're welcome to provide any feedback if you like.
Okay.
Great. Thank you so much. Take care.
Thanks,
Okay.
folks. We'll
Take
see you
care.
tomorrow.
Stay-
Bye-bye.
Bye.
Bye.
One thing on the chat. Okay. Thank you. I'll attend tomorrow. Good. Okay. Okay. How many are going? 18 more. 17. Okay.
Thank you, guys.
Oh, you're welcome.
Thank you.
Okay, see you tomorrow.
See you tomorrow.
Yeah, I have another meeting, so I gotta go, okay?
Okay. All right. Everybody.
Okay, bye-bye.
Bye.
Thanks for an excellent presentation.
Thank
Thank
you.
you.
Thanks.
And
Thank you.
you're welcome.
Take care, Audrey.
Thank you.
You're welcome.
I guess I say goodbye now.
Oh, that's
Yeah,
fine.
yeah,
you can
yeah,
step
it's
away
good.
whenever,
Yeah,
whenever
thank
it's
you.
convenient.
Everybody
We're just
starting to
letting
go.
everyone step away so they can get the survey.
Yeah, yeah, before we can close up shop. 6 more to go. Okay.
I found it interesting too. She mentioned might ask tomorrow the specialized care teams for Parkinson's, dementia, ALS.
Yeah, those are the ones we will look at later on. We'll try
Yeah.
the government one first and then, get ideas from them as well.
Yeah.
But yeah, there's so much health topics that we can talk about. It's amazing. It's amazing. And you know what? Because we are seniors, this does affect us one way or another.
Yeah.
A lot of ones that I have brought up so far has touched me, right?
Sure.
And some of the ones I have attended myself, and I found it's very interesting, right?
Oh, yeah.
So
Yeah.
that makes it.
When my mom wasn't so well, I've been through this whole arrangement with at the time they were called CCAC, Community
Yes.
Care Access
Yeah.
Centers.
Yeah.
And then they changed to LHINs, and I heard Karen mentioned it went to I think oh my goodness, Home and Community Care Support Services, and now it's Ontario Health at Home.
Yeah.
So it's
Yeah.
reorganized a bit over the
Mhm.
years. Kind of reminds me of hydro reorganizing, and we were working there.
But a lot of things like she was talking about providing, I went through with my mother-in-law. We used to get meals
Right.
on bills, and that was through the government.
Right. We tried that with my mom. Yeah.
Right. And then we used to get companions, so they would come and spend an hour with her,
Okay.
just to spend time. And there was, somebody with the same language. All those were provided a while ago under the government. under the government plan. And
Wow.
now you find, okay, wherever the government is dropping, it's a cash grab for the private ones, and that's what this is all about, right? And her costs range from $32 and up. Okay, I mean, you look at it and you say, if I go in a home, a retirement home, my friend Susan just did. She just put her mother-in-law, and she's paying $9 grand, and she was able to get her in Barrie, not
Wow.
even here in Ontario. So for $9 grand, you see what was required. And if it's two people living in the same house who both of them need the care, you might as well hire a private caregiver. And look at that. There are so many options to look at, right? Because the cost is not cheap. It's not cheap to hire home care or any of these private services. Everything is there. It's expensive.
I remember
And I
with my
know that
mom,
OPG does pay for some of the home care, but it has to be at a certain level, which is something I'm going to look more into, but it does pay a little bit. So you just have to go through all the process going through. But everything is expensive. Everything is so expensive, and you kind of wonder, where you go from here, right?
Yeah,
Because we are in the same shoes. I have people who are going to third world countries to see, is it cheaper to go and stay there so you can get 24-hour care?
Oh, yeah.
Okay, so you'll get a 24-hour care, but the standard of living is not the same as Canada. So there's so many options to look at, right? Because we are all afraid saying, what will happen to us? We are aging. Who will take care of us? Our children have their own lives. So this is where we are looking at options saying, is it home care you want? Is it a caregiver you want to hire? And the caregiver hiring, it goes international, because you Canadians don't want to do home care. I mean, caregiver at home, right?
That's where you bring in people from other countries to
And now even bringing people from another country has changed. At one time, you sponsor, you're spending $5 grand for sponsoring and all that stuff, right? They come here, and at one time you are committed to them for 5 years. So for 5 years, you are paying their salary. And a person they've come for dies in 2 years, you still have to pay for the 3 years.
Oh, wow.
Or else find another home where they can continue for 5 years. Now it's changed. They come here, they don't like the home they are working in. You have already spent $5,000 for the immigration part of it, but they have a right to find another job with somewhere else.
Wow.
So all your money went down. So I'm trying to get the immigration person to come in and talk more about it in our next year's presentation, because this year all my months are gone. But that's something else. We have to look at it, because we have to look at long range. Everything has to be long range, right?
Sure. Plan for what you're going to need in your home when you're 85 or 90.
Exactly. And if it's going to cost you $8 grand each to be put into the retirement home, that's $16,000. $16,000. Can you get a caregiver doing from home 24/7 for a lot cheaper?
Yeah. My neighbor across the hall, she's 90, she's about 91. She's got 3 kids, and she's determined to stay in her place, or maybe her kids are a combination. So her kids have arranged for a caregiver almost 24 hours a day. There's someone that stays overnight, and then there's another one that comes in the morning, and she's there until the evening, and arranges her meals, makes sure she can go to the bathroom and is dressed and everything. And she's happy doing that. But I imagine that's how much are you paying per hour times 24 hours a day? That adds up too.
Makes a big difference. And to keep those people working for you, you cannot pay them minimum wage, because they will jump ship. Right? You have to pay them a living wage.
Yes.
That's what my sons always tell me. Think about it as if you're going to pay them a living wage, not the minimum wage, because nobody's going to stay here for a minimum wage.
Yeah, of course. Right? Of course.
And that's where you have to look at it, as to your financing, your financeability. Government is not going to fund you. There's a lot of limits and red tape you have to go through. And I'm sure she's going to talk about it tomorrow, because there's a lot of red tapes going on. No?
Oh yeah, my neighbor's husband in his younger years started his own business, and it had done quite well. So they have enough money, obviously, to pay for that type of service, but not everybody does.
No, because a friend of mine, her husband was in a home, and she used to hire somebody to go in and give him company during the day. She spent a lot of money on top of the long-term care.
Wow.
Right? Because she wanted to make sure he got the best.
I gotta say, when my mom went into the system about in 2016, and we had a care coordinator who initially didn't approve any hours, and then got reassessed after about 9 months and then approved some hours. And we were lucky to have a really good PSW who came in, and as my mom's needs increased, they increased the hours per week. And then we just arranged it between whether they want to come in the morning or the evening between myself and the PSW, and made sure she was getting showered and everything. It was great to have. It was great to have.
Yeah, but
So
things have changed.
I guess it depends on the individual relationships though.
Yeah. And the thing with us is because we have seen what our parents have gone through and the care that they have gone through, we want to see how we can better that care for ourselves. And this is where the knowledge and education is important, right?
Yeah.
And you bring it to the pensioners and see, this is what's out there. Like she was talking about respite care.
Okay.
She didn't describe much about the respite care, but the respite care is basically you want to take time for yourself. And in order to do that, you got to put your loved one in a setting that they look after them for a week, so you can go on holidays with a peace of mind. Okay, and this is more like long-term cares where they have an area where they take care of people temporary, like 1 week, 2 weeks, whatever, right? But people, CCAC will not talk about it. When my mom was alive, I had heard about it from a friend who told me about the respite care. And then I approached the CCAC, and then she gave me the list of places I can call, but they don't come out and tell you that.
Your situation is exactly like mine. That was the same situation. Yeah, because I had to be with my mom 24 hours a day in later years. Yeah. It was just a matter of checking, can you handle looking at other homes in the neighborhood? Can you handle mom or support mom for a little while?
Yeah. So and the way I heard about it, it is so funny. I went to the mall, I was shopping, right? And I was in the aisle. So this one lady was there, and I'm friendly. I say hi to everybody, and I said hi to her. Then I went in the second aisle, and I see her again. And she says, "Oh, it's a coincidence. We are meeting quite often." I said, "Oh, So then I stood in line, and she was behind me. And I said to her, "Hi again." And so I said, "It's nice to meet you." And then she was talking about how her mom passed away from Alzheimer's. And I said, "My mom has Alzheimer's." And she says, "Nazma, look after yourself." And I'm looking at this lady I have never met before in my life. And I'm saying to her, like, "What do you mean?" And she's the one who told me about respite care.
Oh, wow.
Nobody else told me that, right?
Wow.
And that's when I got in touch with CCACs, and I was able to take my mom. It was in Etobicoke, because every holiday we went to, like my husband and I, we would take my mom, and we would do, go Jamaica, Punta Cana, and she hated it because I love to sit in the sun, right? And she was bored. She had Alzheimer's, and she would say, "Nazma, I don't like this." So she would kind of ruin your holidays, right? And then it came to a point like saying, "What do we do?" But when I heard about respite care, I was able to put her in for a week. And, peace of mind that, it's a right environment. And
did you find a retirement home or a long-term care home or something?
It was a long-term care home, but they had a respite care in there, right?
Oh, okay.
So a friend of mine, unfortunately, hers turned out very bad because she ended up hiring a caregiver privately. And she had gone away. She was supposed to go away for about 6 weeks. This caregiver, they tested, the couple went away to Niagara Falls for the weekend, and they let her look after the mother, came back, everything was fine. Well, when my friend went away, and she found out the caregiver beat her up, abused her to the point that the mother died.
That's terrible.
Yeah, she went into a coma and the mother died, right?
Wow.
So hers was a case like you might hire somebody privately, but you have to know what to hire, right?
Yeah.
This is also a scary thought. So when we are at our age now, we hear about what's happening to your friends' parents or other people, and you don't want that to happen. So that's why the education is so important, right?
Yes. For my mom's case, I was my mom needed a lot of help, and I couldn't find a local home that could look after her. So what I wound up doing, I had about 14 hours a week of PSW support. So I doubled up the hours once a week, and there were 2 people there that could toilet her and look after her while I could step away for a couple of hours. So that's what ended up working for us. Yeah. And I knew the PSWs that also served other people in the building, so I was confident she was in good hands there. But
there is a lot, because now there is a government thing where they can get a PSW coming to your house 30 hours a month.
30 hours a month. Wow. Okay.
Okay, so say for example, you have something going on and you need 2 hours on that. So you can call her and say, come in for 2 hours while I'm going to do whatever errands I have to do. It doesn't
Mhm.
have to be an everyday 1 hour, come and give her a bath or whatever, right?
Mhm.
So, but to qualify for that, it's a big red tape to go through, right?
Okay.
So
Wow.
interesting. But anyways, this is a very heavy topic. Yeah. So it
Yeah.
is something we still have to look into.
Yes. Lots of interest, obviously, lots of
yes.
questions. So that's
Yeah,
good.
there were a lot of questions. So, you know, I mean, again, to find out, can you write it off as a tax expense, right? Income
Yeah.
tax expense, because yeah, some things you can write off, some things you can't write. We kind of wait and see. So
Yeah.
anyways, we'll talk to you tonight in our next meeting. I think everybody's gone, so now we can leave and I think and we can see what the service is from there.
And sounds good. And of course, we'll get together tomorrow for same time for the part 2.
Yeah, but tonight we are seeing you at 7 p.m., right?
Absolutely. Yes.
Okay, thanks,
Okay.
Colin. Take
Thanks,
care.
Nazma.
Okay,
Bye, everybody. Take care.
Bye.